what about it? In a blink of an eye, this is again one more week, one more Friday, one new opportunity to sit and talk with you with health items that I think are very important for all of us. And today, I'm going to talk about something that I'm sure worries you, whatever your gender is. Because if you're a male, you might be concerned with it. If you're a female, you might have a spouse, you might have a friend, you might have a father that has prostatic problems. So let's talk about it. Let's discuss it. Let's openly tell you what is around it, what is not, and what we can do. That's the most important thing. I'm Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital, and like every Friday, I'm broadcasting to you through the courtesy of Truth Be Told Radio Network. Remember that every Friday at 7 p.m. Eastern Standard Time, we broadcast these programs for you. And we repeat the program every Saturday morning, 9:30 a.m. Eastern Standard Time. That is the morning. Saturday is in the morning, Friday is in the evening. But it gets a lot better because now on Spotify, you can search for Truth Be Told Radio Network and listen to your convenience. You choose the time, you choose what length of the program you listen to, you choose what to share with other friends, with co-workers and so forth, and say, hey, why don't you listen to this? I think it's interesting, or I heard you concerned about this health issue. I think Dr. Rodriguez is talking about it, and you might want to hear what he has to say about this subject. And today we're going to talk about prostate. And we're going to talk about prostate because it is unfortunately a very frequent first inconvenience, second problem, third could be a cause of a deadly disease, which is prostatic cancer. And it's not a simple thing. Prostate cancer is the most frequent cancer in males, just above lung cancer. But with lung cancer, many times you say, well, it's because I smoked. Watch it. If you smoke, just brace yourself because it might be coming. You're paying, you're getting your money out to buy cigarettes, and then you smoke them willingly, happily, and you might be bringing death to your life. But this is not the case. With prostate, we all of a sudden can develop this disease, and we don't know exactly where it came from, and we don't know how to deal with it. And then you go to the doctor and you're going to get different opinions, because the other unfortunate part is that once you develop the cancer, there's not going to be a unified criteria for treatment. It's going to depend on your age, your general health status, your urinary problems, your general well-being, your future expectations, what you can expect to do in the next, in the forthcoming years, etc. So it's not as easy as an appendix. You have an appendix, no matter who you are, how old you are, how big, how small. You go to the doctor, they do an appendectomy, they take it out, and that's history. You can forget about it. This is not the case. With prostatic cancer, once they tell you you have prostate cancer, well, then it's the time to start thinking and discussing, and you're going to have many times, I have had many patients that have had lengthy discussions with the oncologist, with the doctor, with the urologist, to see what are the possibilities, what you can do, what you cannot do, what you shouldn't do. And in putting all those things in perspective is how you're going to be clearing the way to say, this is what I can do, this is what I'm going to do. I have seen all sorts of cases. But one thing is for sure, age is very much connected. Let me explain. Prostatic problems is one of those things that come with age, like wrinkles. Some people get more, some people get less. Some people don't mind it. Some people are even proud of them. So wrinkles come with age, but not necessarily. It depends on a lot of things. Genetics, how was your family, nutrition, how was your diet. Cigarette smoking, again, affects wrinkling very much because it creates a circulatory problem, microcirculatory problems of the skin. So there are all sorts of things. And with prostate problems, as we get older and older, all of a sudden, we start noticing the symptoms of what is called the benign growth of the prostate gland. Well, the prostate gland is located in a very strategic position. You know, we have the kidneys that clear the blood from a lot of toxic substances. Then that clearing, that cleansing is going to be concentrated so we do not waste a lot of water. Then that concentrated disposal is going to go through some tubes that are called the urethras down to the bladder. And the bladder is the container where we're going to be accumulating drop by drop of urine until we have a volume that let us know this is time to void that container. We have to empty it. I just got a cleaning machine where you can vacuum and clean, mop at the same time. And I'm very impressed because you can vacuum clean and mop at the same time with very little water. But that little machine has a clean water tank and a dirty water tank. And every time you're working, you're happily doing your thing, and every now and then the machine starts telling you, please clean or empty the dirty water tank. And then you have to stop doing what you're doing, and then sure enough, you can see the dirty water tank with a muddy thing that you have to empty, clean, and put it back again so the machine continues to work. It's the same with the body. You're doing your thing, you're going around, you go shopping, if you're a teacher, you go and teach your children, you do your daily life, you go with friends, you have lunch, you name it. But every now and then, you have that voice that tells you, you have to empty the dirty water tank. We are all too familiar with the feeling. And then you have to excuse yourself, or you have to stop doing what you're doing, and you have to void and clean that water tank, that dirty water tank. Now you're ready to go. Now we can continue doing what we have to do, and everything works fantastic. Well, when you're about to void the bladder, everything empties through a single tube. That's called the urethra. And the urethra goes out to the toilet. So then is when you pee, that's when you urinate, then is when you empty this tank, because the bladder has muscle so it can push all the contents out of the body. Women, no problem. They have a little problem. They have a very short urethra. So infections in the bladder can be a lot easier than infections in men, because the urethra is a lot longer in men than what it is in women. So But take that disadvantage out, and you have a big problem. The big problem is called the prostate gland. The prostate gland is located just as the urethra leaves the bladder to the end of the penis. And that prostate is a gland that's around that tube. It's going to work fantastic as long as it keeps its size and dimensions, and most importantly, the pathway for urine to go out of the body. No problem with that. Why is the gland located there? That's the first question. Well, because it produces the fluid in which sperm is going to float, is going to be transferred, is going to transit once it gets to do its job. It nourishes the sperm. It makes it flow. And it contains the energy the sperm needs to do its job. So that's why it is located there. Because when we produce semen, that semen has to have that fluid that comes from the prostate, and it's in the perfect location to empty through the urethra to the end of the penis. The problem is that as we age, I have always complained about that fact, this gland starts to grow. As it grows, it is going to be closing in the tube that transfers the urine. And that produces a backup in urine. And that produces a hurdle. And that hurdle has to be overcome by pushing harder. And even pushing harder, you do not empty completely as you used to. So the feeling that you have to go again continues to be there. And then you go and go and go, only to urinate a little bit each time. That's probably the first symptom you have when you have a prostate problem. And mostly occurs at night. That's a very well-known symptom for prostatic growth that many men know about. Don't go anyway. We have to keep talking about this. I'm back, friends. And today we're talking about prostatic problems and cancer of the prostate in particular. I'm Dr. Rodrigo Rodriguez, medical director of BioCare Hospital, and we have discussed briefly what is the prostate, where is it located, and why it can give us frequent problems. The most important reason is the growth of the prostatic gland. It is located right at the top of the urethra, which is the tube that drains the urine from the bladder out. And we were saying that the presence of the prostate in that location is because it produces what's called the seminal fluid, which is the fluid in which sperm floats, sperms can move, and sperms got the energy from. A sperm is a very simple half cell. It has very little material to work. It is just genetic material with a tail for motion, and that's it. So it is very energy dependent from the surrounding. And that energy comes from the seminal fluid produced by the prostate. But we were saying that very much like wrinkles, as we grow older, for a reason that's not fully understood, the prostate gland starts to grow. And then as it grows, we lose the caliber of that tube that lets the urine go out of the body. So we get a backup effect on the urine, and that backup effect produces that when we go to void the bladder, we don't void it completely, just part of it, because the bladder has to do a bigger effort to let the urine out, to drain it. And that produces that we empty part of it, and that's it. We feel like we did what we had to do, only to find out a little later that we have to go again. We're not getting a lot more urine. We have the same urine as ever. It's just that we don't completely empty the bladder each time as we used to. And that is the symptom of what's the benign prostatic growth. And we have to be aware of it. We are aware of it, unfortunately. It's not just being aware of it. We notice it immediately that all of a sudden you have to go more frequent. I explained you the reason. And for certain reasons, this is a lot more obvious at night. So sometimes we have to wake up, go and void, come back, barely catching up the sleep again. We have to go back again. And that happens over and over and over again. And we begin to have the side effects, the problems of all this. We're tired, we don't feel well, and we never empty the bladder. Now, this stagnant urine is also easier to get infected. So urinary infections can become more frequent than usual. So we start suffering some of the effects of aging that can be very bothersome for some people, can be problematic for other people. Some people, it's like menopause. Some people can glide through it without too much of a problem. So it varies person to person. And for some people, it can be so important that they need to undergo surgery or other procedures just to free the channel and be able to void correctly and normally again. So it can be very complicated, can be very simple. And we're going to talk a little bit about what depends on and what we can do about it. Now, prostate cancer is a type of cancer that is very insidious. It's very slow moving. It is contrary to the benign prostatic growth that we have been describing, can be completely silent. We might not have any symptom whatsoever. We might even be happy that, oh, I know my friends are having a lot of prostatic problems, but I don't have any. I'm fine. I'm in perfect condition. So I don't know what came down on them, but the fact is that I'm in very good shape. But a cancer might be already developing. A cancer cell might be already producing a bigger and bigger colony. And contrary to benign prostatic growth, cancers do not produce a big growth of the prostatic gland. So urinary symptoms are neither frequent nor so problematic as they are in the prostatic benign growth. So we don't know. And that's the problem. That's the problem of this type of diseases, because you say, what can I do about it if I don't know about it? This is very much like what we have told you about high blood pressure, that we have told you about diabetes, that we have told you about other diseases, where we don't even know. Fatty liver, for example. We don't even know. So what can we do? I'm going to tell you what we normally do. What we normally do, we do nothing, we don't act upon anything, and we just wait till the disease is so advanced, so problematic, that it becomes expensive, treatments become inefficient, expensive, and then we have a big problem to deal with. What's the moral of this story? The moral of this story is warning, warning, awareness, awareness. It is our duty to make sure that our bodies work. I give you a good example. You're planning a vacation to Yosemite, to Lake Tahoe. You're bringing all the family. You got a nice car, a 4x4. You have a camper. You're planning all this to take your family together on this big trip. You're going to drive 800 miles, 1,000 miles, whatever. You don't jump in the car, start the engine, and go. No, you take a day or two to make sure everything is fine. And you say, I'll be back. I'm going to check the oil. I'm going to check the pressure in the tires. I'm going to make sure that the coolant is there, that the engine will not overheat, because we're going to go uphill and downhill, and the summertime, I'm going to need the air conditioning. Don't you do that? You have a family to take care of. You have a vehicle that's going to make that possible. So what you do, you make sure that vehicle is in good shape. It doesn't have any faults. It has good tires, good air pressure, good oil, good everything, because you want to have an uneventful trip. You want to enjoy. You want to be with everybody you love. You don't want to spend 2-3 days, as happens with many people, that they go on vacation and end up spending 3 days in a small town because the car has to go to the garage. That's not what you want. So what you do, you take preventative actions. You are aware of problems that might be there, and you check them all. You check your air conditioning, your lubrication, your tires, your engine, you name it. That's what you have to do with your body every morning. I insist. Every morning you say, good morning, how are you? How did you sleep? How did you feel? Did you sweat at night? Did you have any problems? Did you have to get out of bed several times because of urination? Did you have any pain doing it? Did you have any problem? Etc., etc., etc. Not only in regard to your prostate, in regard to your whole body. Are you dizzy? Can you keep your equilibrium? Can you go upstairs without getting short of breath? Can you go downstairs? You feel like doing it, like getting out and taking a shower and face a new day? Or you're just very down, very tired, and so on. So if you start doing that every day, if you start watching your body every day, then you're on the right track to control problems when they happen, or even to prevent them, even to be able to take them off your life altogether. But it goes beyond that, because like with prostatic cancer, sometimes you have to be proactive. It's not how you feel, you have to be very proactive. And you have to say, okay, I don't have any urinary symptoms, but still, I'm going to check my prostate gland. How do I do that? Well, I can go to the urologist, have an examination. I can have a blood test to see if there are any signs or any symptoms that could be telling me there is going to be a prostatic problem. And if you start doing that, you might be able to catch a problem right at the beginning and be very successful. And I tell you because I know people who have done exactly that. When you start when you're 40, when you're 45, when you're 50 at the latest. Why? Because at that point in time, there are many things you can do that are basically not even medical procedures that can change your life for better. I know it because I have seen people that do it. I have had people that came to BioCare and told me, I want to make sure everything is fine. And you know what? We prevented big problems. Don't go anywhere, because I want to keep on talking with you. Well, you are now with Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And we've been talking about prostatic problems, and cancer of the prostate. Why? Because it's a very important subject for all of us. Even if you're not a man, you might have somebody you love that you're concerned about. You might watch your spouse getting up all night long every so often because he has to void, and you can say, you know what, you might have a prostatic problem. Why don't we have it checked? And I was telling you that when you are really vigilant, when you're really aware of things, you can change things for the better. Let me tell you a little story of a very smart patient. This is a man who was 50 years old, and he came to BioCare because he told us this story that he was concerned about prostatic cancer. And of course, the question is there any reason you're very concerned? Have you had any symptom, etc.? And he says, no, I don't have any problem. I'm perfectly all right. But my father, who's 77, was diagnosed with prostatic cancer. And the doctor told me that it could run in the family. So I want to make sure that I'm fine. So we did everything we could, and there was a little problem with PSA. It was a little elevated. So this man said, no, I want to make sure. And he went to two of the best places you can go for fantastic diagnosis. One is Berkeley, and the other one is Bethesda, Maryland, the National Institutes of Health. And this was the type of guy that never took no for an answer, so he sought help, he talked to people, he talked to physicians, and everybody was saying, but you're fine, we don't see anything. So finally, there is a test, a very sophisticated test, where you can look for cancer cells in the prostate. Well, he did that test, that's in Berkeley. And they found 3 little nests of cells that they could think they were malignant. And he said, so it's just a matter of time before I know I have cancer of the prostate. So he came back to BioCare. He says, doctor, I have all this information now. Of course, I'm not going to do surgery, no need for that. He still 50 years old, a very active sex life, very happy marriage, everything going fine. He was not about to do any drastic thing like this. Actually, in both places, Bethesda in Berkeley, they told him, do nothing. This will develop very slowly, and when you have the real problem, then is when you come back to us. That was their answer. But again, he didn't take no for an answer. That's why he came back to BioCare. So we reviewed everything, and we were part by part, and then we found something that might be the key. He had something that's called dyslipidemia. In other words, he couldn't handle well fats in his body. You know, like cholesterol, like some of the other fats, triglycerides, and so on in the blood. But it wasn't very important. However, there are many studies that link prostatic cancer to fat intake and fat metabolic problems. And sure enough, we know cancer of the prostate is very dependent on hormonal levels. And fat metabolic dysfunction can produce hormonal disorders. Very mild, very difficult to diagnose, but they can. So what he did is he started a diet in which he completely erased fats from his food. He started going basically vegetarian. The only fats he would eat were omega-3s because he ate fish. And he was very careful. He wasn't fat, but he lost like 20 pounds. He looked fantastic. I mean, he not only looked fantastic, but he gained like 10 years of looks. He didn't look 50 anymore, he looked 40. Looked very good, and all this was fantastic. What we added to that program, there are a group of substances that can help the prostatic the gland in a very fantastic way. One of them is something called phytosterols. Phytosterols are plant byproducts that can mimic the chemical form of certain hormones. But they only have the appearance, but not the function of the hormone. So when you eat phytosterols, you fool your body into believing that it has enough hormones and your body makes less. One of the problems in today's diet is that we have a hormonal assault. We're overwhelming our bodies with hormones because we use them to raise, to produce, to etc., etc. So dairy products, eggs, anything that comes from animal feed contains these products, these hormonal products. And they're becoming a real burden to your body. So by taking phytosterols, what you do is you reduce the amount of endogenous hormones that we produce. And by going on a very strict diet and taking a vegetarian diet basically and fish, if you get deep fish, deep water fish, you don't have any hormonal content. Number one. Number two, if you take a lot of plants and fruits and vegetables, you take a lot of phytosterols. So your body is making less hormones. And the lesser the hormonal assault, the better off you're going to be in terms of breast cancer and prostatic gland cancer, because the two of them are hormone dependent. The two of them can be triggered by an excess of hormones, And the two of them are going to improve if we decrease the hormonal level. So if we do that, we begin to improve. He also took a treatment called alivisados. The alivisados treatment is a very special treatment in which we look for the action of a very complicated vitamin compound in the body, which is called NADH for short. And I'm not going to give you the chemical name. All you want to know is that this substance is very important in helping the immune system. It helps some very specific white blood cells that are very active against cancer, and they can repair genes. In other words, if by your daily life, by your daily routine, by toxics that you took, by stress you have gone through, etc., if you have damaged some of your genes, they will repair, this substance will repair them. And this program that I'm telling you about will introduce in your body the substances with which your body is going to be able to do this. Mainly the nicotinic acid, the niacinamide. All this is going to produce a very good response. And it's a simple intravenous treatment where you give all these compounds concentrated, and there they are, they're already in your body. You don't have to wait for anything. Well, he was under all this program, and then he went on his own, continued to do this thing. 6 months after, he went back to Berkeley, and he said, I want to be rechecked. And they said, it'll probably be the same. It's too soon. You have to come like in 2-3 years to see if there is a growth. They're going to be about the same. Well, he insisted, he had the test done, and guess what? There was nothing. They said, what happened? They should be there. They never go back. They grow slowly, but don't go back. Well, he's very happy. We're talking about 10 years now. He's very happy. No symptoms, no problems. All his tests are clear. He looks very good. Now he looks 50, but he's over 60. And everything has been successful. And I have to say, first of all, because he insisted. He was very proactive in making sure that his father's prostate cancer was not going to be in his body. No surgeries, no radiation, no nothing. Just lifestyle changes that produce the effects that we want. Phytosterols are very powerful. And they, for example, are contained in something that's very popular in the Far East, which is soy. Phytosterols will mimic estrogens, will mimic other hormones, so your body produces less hormones. And guess what? Japanese women, for example, have a lot less breast cancer than American women. Because we tend to eat what is harmful. And I'm sorry to say it, but we do not pay any attention of what we bring into our bodies. And we're very confident that we don't have to. Because if a problem comes, you go to the doctor, he gives a prescription, and you're fine. The story doesn't go that well. Stay with me. We have to talk more about BioCaring yourself. Thank you very much for letting me talk to you and discuss issues that I think are interesting to you. I hope I'm right. I hope I'm touching on subjects that you might have some concern or that you might want to know anything about it. If you do, if you feel that this doctor from BioCare Hospital, through me, Dr. Rodrigo Rodriguez, is important, share it with other people. We are in the social media of your choice, and we're open to questions and comments. So you can ask a question, you can make a comment, and I will get back to you. I will answer your questions. Furthermore, we have toll-free numbers. We have all sorts of possibilities to connect. So a phone call, a click, is going to put us on a one-to-one conversation. I would ask you to follow all these programs because I do it from the bottom of my heart, because I get to see people with very sad diseases, with very sad conditions that do not have to be there. They don't have to suffer for all these problems. You see, we have the possibility of bypass, of stave off disease in many ways. So let's take advantage of that. I come from the generation, because I saw it all coming. Not exactly right, but I saw how the changes were affecting everybody not in the right way. I was born in the beginning of the 1940s, when Second World War was at full swing. I started medical school in the early 60s, and I could see how things started to change. I came from a traditional family. We used to have a chicken hut. My mother would take care of chicken for the family, and we had fresh eggs, and my mother would really make a big effort to make sure we got fresh vegetables and fruits and everything. And my father, who was an accountant, for some reason, always thought that meat every day is not good for the children, he used to say. So we used to get red meats probably once a week and fish 1 or 2 times a week. That's it. But the rest of the week used to be kind of vegetarian. We had a lot of garbanzo beans and beans, all sorts of beans, and fava beans, you name it, and vegetables and broccoli and cauliflower and a lot of things. And we changed all that all year long because food was very seasonal. We didn't have, as we have today, the possibility of having mangoes in January. And I was growing up in Mexico. We still didn't have mangoes in January. We had to wait for the mango season or the watermelon season, whatever. So we made a lot of changes. And for my mother to give you a snack or to give you a candy, she would buy a big sack of oranges and put them in one corner of the house. And if we were hungry, we wanted something to eat, all we had to do is take one orange, peel it, and eat it. And my mother used to do that because it kept very well, so she could just buy it once a week. And it was a different way to eat. And then I saw how things started to change. And I always had a question. I had a question because my instinct told me we were not going in the right direction, that some things were not right. And then already in medical school, I started hearing to things that were completely absurd to me, like eggs are bad, you shouldn't eat eggs. And butter is bad, you should eat margarine. And vegetable oils are better than lard. So all these things that I had grown with were now the villains. The villains were the bad thing. So we started seeing how food started to change. But then I started how a lot of problems started to happen. When I was in medical school, Alzheimer was a rarity. Diabetes was just for very few people. Asthma, I don't remember any asthmatic friend, family member, or classmate when I was growing up. Now I know a lot. And a lot of things started to change because we were working against our bodies. So it's just simple knowledge, simple intuition. If God provided us with some foods, why should I take it to a factory to be improved? And then I get my food in a can, in a bottle, in a box, in a foil, and it's prepared for my convenience. So prostate is one of those problems. The more fat, the more bad fat, which is vegetable oils you eat, the worse off you're going to be. Vegetable oils are in a lot of the things that we eat every day, in French fries, in mayo, in commercial salad dressing, in cookies, in ice cream. We're having vegetable oils in things we shouldn't have it. What is the answer? The answer is BioCare. I want to invite you to think seriously about the possibility of say, I'm going to do like this gentleman. I'm going to go to BioCare and say, I don't have any symptom, but somebody in my family has prostatic cancer. I want to make sure where I am. Because if I can have an early diagnosis, and if I can start making my lifestyle changes, and if I can start getting the treatments that Dr. Rodriguez is talking about, with the aliphysatos therapy, with the nicotine acid, with the niacinamide, with the vitamin B3, it's actually part of the vitamin B3, with the phytosterols, with all these things that I can get in a natural way. I mean, if you start looking around, you're going to see, for example, that lycopene, which is one phytosterol, lycopene in tomatoes can be very good for your prostate. And the good news is that when you cook tomatoes, lycopenes become more active. So you can go ahead and enjoy a pizza, a well-done pizza with real tomatoes. That's the problem. We have so many fake foods that we think. People tell me, doctor, but I eat a lot of tomato because I buy this sauce. No, you need to buy tomatoes. It takes you half an hour to do a good tomato sauce. And if you have any questions, you can go to BioCare website and look at the recipes. And if you want more recipes, give me a call. Send me an email. But when people do that, and they go through these programs, they might be avoiding a very long, difficult disease, very expensive disease. So you have to really think about it. It's time to take my body to the garage. It's time to get it ready for the big journey. It's time to get it ready for all that adventure that I still have to live with my family, with my friends. So why don't I take a couple of weeks of my life and be tested and be checked and that's the most important, and start doing what I have to do. Learn how to do it. Get it directly in the vein. I don't have to take a pill for 3 months before I get the benefit. I'm going to get it right today. And I'm going to meet people that are doing it, that have done it, and that are very happy they started. because they have had a longer, healthier life. That's what BioCare is. BioCare is about vigilance, awareness, and proactiveness. It's about putting together everything we know in order to change things for the better. Nutritionally, it's very important to change a lot of things. And once again, it's not because I want to insist in nutrition, but it is because what we put in our mouths and the way we eat every day and the lifestyles we lead, what keeps us in good shape or in bad shape. Very much the same as your car. If the care you give to your car is good and frequent and timely, you're going to have a great car for years to come. If you go and just have party with it and forget about services and lubrication and tire care, etc., you're going to have a junk in no time, no matter how expensive your car is, no matter how good it is, no matter how make it is, you're going to have a piece of junk. And that's very easy to understand. The best car in the world is not going to stand miscare. But if you are careful, sometimes a very simple car can provide you a lot of long service. Same your body. Be vigilant. Love yourself. Take care of yourself. Prepare your body to keep doing what's been done for many years. We all have enjoyed so many years already. Well, let's keep doing that. The answer is BioCare. Why do I have to tell you that? Because I know for a fact that when you start doing this and that at home, you don't do exactly what you need to do. You don't know how to proceed. You don't know how to put it together. You need guidance. You need inspiration. Guidance will come from BioCare Hospital. Inspiration will come from all the people you're going to meet that are going to tell you how well they are, because they do what you are about to start doing. I'll see you next week. Please BioCare yourself in the meantime.